Like it or not, the Affordable Care Act, or Obamacare, is the law of the land this week, and there are at least 5 things you should know as the new program rolls out. For one, a key part of the law starts Tuesday, even with a government shutdown, and a lot of people aren't aware of that. Obamacare opens new marketplaces, also called state-based exchanges, for buying health insurance October 1st. But 2/3 of the public and 75% of the uninsured had no idea in a mid-September survey. A writer for The Washington Post says those stats are either a disaster, since the White House has had more than 3 years now to talk about the Affordable Care Act, or they're just because marketplace directors say they're holding their advertising fire until enrollment is actually an option. Certainly, Americans will have a lot of time to act. That first enrollment period is open from October all the way until March 31st, 2014, and those plans will only kick in January 1st at the earliest. 2. Who's eligible? Anyone without affordable health insurance through work or from Medicare or Medicaid can apply for health insurance through these new marketplaces. The Census Bureau found 48 million Americans lacked health insurance last year. Almost all of them will need to sign up for a new Obamacare plan. Also affected right away, the 15 million people who buy insurance on their own, not through their job, and workers whose job-based insurance just isn't affordable. If their own health coverage costs more than 9.5% of their income, it's classified as not affordable. Now, if you're one of the 60% of Americans who gets affordable insurance through work, that October 1st date probably won't affect you. But for people with pre-existing conditions, October 1st means a lot. Out of those 48 million people without health insurance, many can't afford a plan because they have a pre-existing condition, even something as simple as weight problems. Giving those people a chance to buy coverage is a big part of Obamacare. The law will not allow insurance companies to refuse coverage or hike up rates because of pre-existing conditions. 4. The individual mandate. You've probably heard of this before. With exceptions for the very poor, the mandate will force every American to have health insurance or pay a penalty fee in 2014. Getting more people to buy health insurance is meant to cover the cost of insuring people with those pre-existing conditions, who would normally have to pay a lot more. This is a major part of Obamacare. And finally, how to get started buying your own health insurance through the Affordable Care Act. That one's pretty simple, and it starts online at healthcare.gov. The new program's webpage is open for business Tuesday, guiding health insurance shoppers through various gold, silver, bronze, and platinum plans, with much more information than we could hope to fit in this video. For Newsy, I'm Zach Toombs.